welcome all of you. Good morning, good afternoon, and good evening. And I'm moderating from New Brunswick today because Anna's just had some things to deal with at short notice. So it's my great pleasure to be part of this important event. It's a distinct pleasure to have a conversation with Jane Meadus today. Jane and I know one another, but I know Jane as this formidable activist. Yes, indeed. Jane is a staff lawyer and she's part of the institutional advocate at the Advocacy Centre for the Elderly. And in her formal life, she represents clients in long-term care, hospitals, psychiatric facilities, care homes, with respect to related legal issues. But I can tell you, apart from all of the qualifications and the awards that Jane has, which are many, including Distinguished Fellow of the Canadian Centre for Elder Law Studies, the 2016 recipient of the Osgood Professional Development Award for Outstanding Contribution to CLE, and the 2022 recipient of the Ontario Health Coalition Orville Thacker Award for recognising exceptional commitment. Jane is one of those people that you want standing beside you, because Jane will stand with and on behalf of you with respect to legal issues. And, you know, while we can talk about Jane's formal qualifications, you know, there is something intrinsic in Jane's way that she is as a person that gives every confidence, you know, that she will be in your corner. And that's why it's so unique to have a conversation with Jane this morning. Welcome, Jane. It's great to be with you, and thank you for the opportunity to talk, particularly at 7 a.m. in Toronto. I know that you're not an early morning person.
I'm not.
But thank you. Thank you.
Well, thank you very much for having me. I appreciate and I look forward to our conversation today.
Look, Jane, I just want to start by formally acknowledging from my perspective, you know, a great friend of yours, and that was Judith Wall, who passed away recently. And so I just want to provide context to this is really a conversation that Judith would be right into as well, you know, representing the needs of older people. So can you talk a little bit about your personal journey and what brings you to this place in your career now?
Well, so I became a lawyer in 1993, a long time ago now, and was interested in doing something in the health law field. I actually had scoliosis, so I had two surgeries prior to becoming a lawyer, one when I was a teenager and one during law school. And sort of that journey for being in sort of hospitals and in a lot of places like that, and advocating for myself and actually for other patients in the hospital sort of was something that I was very interested in. Started at a firm that did a lot of mental health law. And then when this position came at the Advocacy Centre for the Elderly, which is a legal position that specifically represents people in institutions, hospitals, but mostly in long-term care homes, not not malpractice or anything, but really advocating for the rights of the person. It was just sort of that role that I really wanted, and it's funny because I remember doing my interviews with Judith and calling her, and at the time Legal Aid, which is our funder, it was, you know, there's always this sort of issue of whether you're going to get your funding or if they're going to cut, because, you know, legal clinics are not necessarily the most glamorous things that governments fund. They weren't sure about the position, and I just begged her. I said, you know, if you lose the funding, I'll leave quietly, that'll be fine, but I really, really, really want this job. And she gave it to me, and I had the privilege of working the entire beginning of my career there, up until she retired in 2017. Our offices were next door to each other, so we spent a lot of time together and sort of learned how to advocate for the elderly, for seniors, whatever the terminology you want to use. I know everybody uses different terminologies these days.
Yeah.
But how to advocate for them for their rights. We're not there to work in people's best interest. I mean, we advocate and we, look at government legislation and do policy work on that. But for our actual representation of people, it's what is it they want and what are their rights. It may not be what we think they should do or what we would think that what maybe our parents, if it was that what we would advocate for them, but we advocate for their rights and just like any other lawyer does.
But it's interesting, Jane. You said that, it's clearly there was something passionate, and I don't believe that you or Judith would leave quietly at all. However, um, you said that it started from self-advocating. And
Mhm.
I think that's something that we don't do very well. Can you just unpack that a little bit?
Mm.
Because it's quite difficult to advocate for ourselves in a healthcare system or institutional setting. So, can you just touch on a little bit about that?
Yeah, and it's funny because Judith, for those of you who don't know, she was the person who was the first employee at ACE. She started in 19. She was the first employee in 1984 once they'd set up the clinic, and at the end of her life, she had cancer and was quite ill and was in hospital. And she found this as well, that when you're in the hospital and you know your rights, and we obviously we practice health law and we know our rights on consent and things like that, that you are still at the mercy of these people that you are getting care from, and you
Mm,
really have to very deftly navigate between your rights and how to not piss them off, that they're going to
mm,
get upset at you.
mm,
And it,
mm,
it really is a very delicate balance there.
mm,
It's easy for me, and I'll often say this to my clients, in Ontario, we have very robust legislation in long-term care. There's 27 rights, and I'll tell people they have those rights. But I'll say that I understand that it's very difficult to actually enforce those rights and to
mm,
be a person who's going to say, hey, go up against management or go up against the nurse that's doing something, and to have them um to say, you're not doing this right and I don't like this, because people in long-term care homes, they have to live there, and it's not
mm,
like you can just move. Certainly in Ontario, we have 40,000 people on a waiting list. You
mm,
can't just move to another home, so you have to advocate. And so that was something I learned in the hospital, and I would be in hospital and I would have books and I would write these things down and things I didn't like, but I didn't necessarily always advocate for the little things. I had to pick and choose what I
mm,
wanted to advocate for
mm,
myself
mm.
when I was in hospital. And I think, that's probably very standard, because you don't want to get into trouble with the person who's providing that care, that you're really reliant on.
Mm. Thank you. That's a beautiful explanation, because it's almost as if, negotiation, is a critical thing, but it's about what's most important and what can you do without. You've
Mhm.
got to pick and choose. So in some of the cases that you're dealing with, in Ontario, what is the typical and atypical cases? Just to give
Mhm.
people a flavour of what you deal with on a day-to-day basis.
Well, so the typical thing that I would personally deal with on a daily basis, probably our biggest issue is hospital discharge, actually. And so because we have this very long waiting list in Ontario for long-term care homes, and there is a real difference in structural difference, and some of the operators are better than others, I would say. um, People who are in hospital want to make their own choices around where to go into long-term care, and the hospitals obviously want them out, because they need the beds. We have, unfortunately, Ontario has one of the lowest number of beds per capita in Canada, and so it's this fight with the hospital personnel and the people who do the placements into long-term care. to sort of for people to get where they want to go. Um, and we actually have legislation that was passed a couple of years ago that allows them to force choices on you that you don't want. So anything within 75 kilometers in southern Ontario and 150 in northern. And for those of you who aren't familiar with, I don't know how many people here for where people are from, but Ontario is a very, very large province. There's over 1 million square kilometers. And so, you can be sent very far away from your family. And so they decided that that's the way they were going to go, is to choose for people. They can't force you, they can't physically move you, but there's a penalty that you have to pay $400 a day if you stay in hospital if you don't take one of their homes. And so we're fighting against that, but really fighting against, sadly, a lot of misinformation. So we will have people call us and really they're told by hospital personnel and the people who are doing the placement incorrect information. They're told they can't apply from a hospital. They have to go home. They have to choose to go into private care. It's not choose, but they have to go to private care. And so we spend a lot of our time, telling people what their rights are, because they are being provided with a lot of misinformation. So that's the sort of thing that I deal with on a daily basis. We do a lot of long-term care as well, and it's often trying to get that care in a way that you want. It could be around medications, is a very big one, where people aren't being provided with the right information about medications. Just this week, someone called me and said, they were in a long-term care home. They were unhappy with the medications that the doctor put them on, and they were refusing to, they said they had withdrawn consent, but the home was refusing to stop the prescriptions. And so either they threatened to put it in her food, so she doesn't eat at the home anymore. She's, purchasing food from outside. And she has that right to withdraw her consent, and they're refusing to allow it. So those are those sort of cases. And then our office has, lots of other cases, things like we have had a terrible problem with mortgage fraud and frauds around what they were called NOCs, which are sort of liens on your homes, where people, seniors were being sort of forced to, someone would come to the house and convince them. So, very elderly seniors, often living on their own, maybe some capacity issues. And we're being, pushed into purchasing things they didn't want, like water heaters and gas tanks and things like that. And we had a system at the time where it allowed them, the people who were putting these things into the homes, to then put what was essentially a lien on their home, and were without any consent. They didn't need to, do anything other than just actually register. It was when on computer registered it, and people were losing their homes over this. Our office was getting just deluged. I can't even tell you, deluged. Two lawyers full-time doing this. The government actually changed the law a month ago and withdrew that. But there's still a lot of problems with it, where people are still in um, potentially could lose their homes because of these very bad actors. These aren't people that are doing anything legitimate. They're really doing some pretty horrible things. Um, and so we're trying to help some of those people as well, quite a few of them.
Jane, you've given these important case examples that, it really is, you're dealing with a structural environment of policy, as well as the structural environment of healthcare systems that are really constrained and have been constrained for many, many years. And then trying to almost lift this person, into a place, by supporting their rights. It's a very complicated set of scenarios that you're dealing with on a day-to-day basis. I am going to just move to questions and then back to you if you're comfortable with that, because I want to take as many questions as we can. And I will, Shmuel, I have seen your question, but I'm going to go to Dr. Cynthia Stewart, IFA's main rep at the United Nations, for the first question. Cynthia, are you there?
Yes, I am. Good morning, and thank you. I'm really curious how you deal with older persons in those environments that may have infection and or medication, often infection and medication induced confusion. And the
Mhm.
healthcare person comes in and they get labeled
Mhm.
confused, demented, and getting at the underlying cause, and that they may not remain at all confused and shouldn't.
Mhm.
That is such, not to confuse it with somebody who does have dementia. So
Sure.
how do you manage that? I'm just fascinated by your work.
Mhm. Yeah, and so of course we're lawyers, we're not medical people, so that certainly is something that we run into all the time. And just because of the way we work, people are calling into our office. So in a case like that, we would either be getting calls from like a family member, their substitute decision maker, and sort of having those sort of conversations about some of the things that might be going on. So it's not uncommon for us to hear about things like infections and confusion. Being in the hospital, of course, especially if you're elderly, can cause, those kind of issues. And a lot of people just aren't aware of that. And so when that dementia label comes or what have you, we'll, explain to people that, you need to ask some questions about the family member. You need to ask whether or not, this really dementia? Is this something related to like an infection, medications? Could be antipsychotics, could be anything that might be causing some of these confusions, and to have that conversations and send them sort of back to the healthcare personnel. And then we do have quite a few people who get labeled and with a dementia or something that really wasn't there. I have one case right now, and part of the problem, of course, is that we have medical records. I remember when I was in school, it was always if you were bad, it was going to go on your permanent record, right? Which of course was didn't follow you, right? What your medical records do. And if someone wrote dementia in that record at some point, it's there and you're labeled. And even though it might have been something else, and I'm dealing with one right now, and I keep having to explain to my client, we can't erase it from the record. It is there. There are certain things we can do. There's health records issues that we can put notes on it, but it's still very difficult. And the doctor stills come in and you're going from doctor to doctor, you're going from place to place, and that does follow you. And it can be quite devastating, leading to people like on locked units, for example, who should not be there. So it's
Yeah,
something that we're aware of. We do have those discussions, but it can be very difficult to undo sometimes.
thank you.
Thank you, Jane. I'm going to craft the question from Shmuel. Shmuel is with us every week at our global cafes. Now, knowing that Canada is an extremely multiculturally diverse nation,
Mhm.
and Ontario is no different, do you see any differences in the impact of your work in lower socioeconomic population groups or groups of cultural diversity versus any other group? Do they have any different issues that elder law, can support?
Sure. So Ontario is very multicultural, and Toronto is probably one of the most multicultural places in the world, alongside sort of New York or something like that. So it is definitely an issue that we have now. Our clinic is for low-income seniors, so anyone can call and get some information. But primarily, our services are for low-income seniors. So we'll start from there. So, that's our bread and butter. That's who we serve. And just for anyone who's sort of interested, we're funded through our legal aid, and we don't charge for our services. So that's never an issue at our office. So that's a good thing. We are also very lucky to have funding for translators. So if someone calls our office, we can get translators for phone calls to go to meetings, what have you. And so that really helps us because we want to make sure we serve as much of our population as we can. There's definitely, there's definitely issues around cultural issues that you have to be very sensitive of, trying to sort of negotiate. So for example, I do a lot of work around consent capacity, and we have very robust legislation in Ontario that says who's capable, and if you're capable, you make your own decisions. And if you're not capable, there's a list of people who make those, and those may not, for example, gel with something that's cultural. And so we have to explain to people, what the law is, etc. When it comes to long-term care, it's definitely an issue. We do have multicultural homes. We have very linguistically or culturally specific homes. And so trying to assist people getting into those homes and accessing those services is something we do. But many of our clients do end up in, for example, long-term care homes that are, where no one speaks their language, or maybe very few people. And so, trying to ensure that they're getting proper services, I can't tell you how often someone will call me and say, I'll ask them, well, is your mom capable? And they go, yes, but she doesn't speak English, so I make decisions for her. And it's like, yeah, no, that doesn't work that way. The home has to get translators. They have to make sure they're talking to her, not getting the dishwasher from the kitchen to do the translation, not getting the son or the daughter who may have ulterior motives, or, they're not translators. And so to make sure that they're getting the privacy that they are entitled to, and such. So it's definitely something we deal with on a daily basis. We have the luxury of having very good access to a lot of information. And we also do have sister clinics who are specific to some of those cultural areas. So we have like a Southeast Asian clinic and a Chinese clinic. So we sometimes will work with them, who are more, provide them with sort of the legal part, and then they can assist with the other portion of it.
Mm. And of course, donations are welcome, aren't they?
Absolutely.
And if there's a $1 million donator sitting on the call, talk to Jane afterwards, because funding is always a struggle. Always a struggle. You say that you got funding, but if you had $10 million more, how much more can you do? So I just put that out there that, it's always a struggle for these services. I'd like to now move to ask Professor Marie Beaulieu. Welcome, Marie, and do you have a question for Jane?
Yes, well, thank you, and very happy to see you both, James, this morning. As a lot of people are aware on this call, because it's been discussed a few times, there's the open-ended working group on the rights of older person that has been working for 14 years now at the UN. And one of the things that is being done is really the recognition of the gaps in the rights of older person, and also should we have a more binding instrument to recognize those gaps. And what a lot of NGOs are hoping for is a strong convention on the rights of older person, an international convention. So, Jane, I'm always curious to see how practitioners feel that such a convention could be a tool that will influence or have impact in their practice. So I don't know if you had a chance to give a little bit of thought on that perspective, but I would really like to hear from your point of view how that could help in your work.
Sure. And I think, anything anything where that's giving rights or that supports that is really helpful. It's not something that we have been very involved in, I will say, at our office. So I'm not as familiar with sort of the whole nuts and bolts of it. But, we certainly, look to a lot of these instruments, look to, when I'm doing my work, if I'm doing a novel case or something, I look to, something that might happen at the European courts, for human rights. So anything that we can have to support the rights of the older person is certainly welcome. I think that, one of the things that we've found is that, in Ontario, we do have like very robust legislation for long-term care. We have very robust legislation around consent and capacity, but it's getting those enforced and getting the, practitioners and the people who are there to actually read these things, understand them, and to enforce them. And Judith used to always say, good law, bad practice. And so we can have all of these things. And do I think that the practitioner, doctor in a hospital in an emergency room is going to be aware of the UN convention. No, I don't. And so, it's how do you, that is more on the policy level for governments. And that's where I think it helps more sometimes in the court, but, more in that policy and how to meet those convention requirements versus sort of your day-to-day, because it just doesn't come into people's mentality.
Yeah, look, policy without implementation and measurement is useless policy. I want to move on to estate planning now. And having just been through the process, gee, it's complicated. It is really complicated. And I just want to know from your perspective the benefits and what are the strategies that you would recommend, in this whole process.
Sure. So we don't do estate planning in our office. That's certainly something that we, refer out. I think that, obviously it really depends on your situation. And of course, our clients are low income. And so generally don't have a lot of like monetary, complicated trusts and that sort of thing. So that's certainly not something that we deal with. But I think it's really important. And I think that when I would say that when, from our perspective, what we're dealing with estate planning is often those add-ons, which is the power of attorney for personal care or the power of attorney for property. Powers of attorney, they have lots of names around of other things, but someone to make decisions if you're not capable with respect to your own medical decisions, I can't remember the other names for them at the moment, but those sort of things. And I think that one of the things that we do find is that people do these as an add-on. They don't explain to people what they are. I think people are pretty well aware of what an estate trustee or an executor does, but they don't talk to the person who's going to be making decisions about someone's care or someone's property. And people believe that when they're the attorney for property, for example, that it's their piggy bank and that they can use it in any way, and that don't realize they have to keep records and all of those things. And people name people that aren't really trustworthy. And that's where we see a lot of these things going kind of wonky. I think that, as lawyers, many lawyers do not do that properly and don't explain it and don't do any support for the person who is going to be that decision maker. So when this comes up and often with personal care, it's, a medical emergency, and all of a sudden they're making decisions. They don't know what the rules are. They're not lawyers. They don't know. So I think that doing it as part of estate planning, lawyers are very good at doing the property part of it and the sort of normal thing, but they often do add on these, we'll do the powers of attorney as well as sort of a throw off, and they're not as well educated, and they don't educate their clients or the person that's being going to be their decision maker. And I think that's something we really fail at.
I think we do fail at that, Jane. And certainly we need to, perhaps as a community, pay a little bit more attention, to this whole area, and if you are going to be the decision maker on behalf of, then what do you need to know and what's the processes? And so I think that's something that, IFA and others on the call could actually, start talking about and talking with you about. So I'm going to go to Dominic Boyd now. Dominic, you have a question for Jane.
Thank you, Jane. Hi, Jane.
Hi.
Yeah, so I'm interested to know what you've learned, Jane, about the difference between federal law and provincial law. I know that a lot of the health stuff is provincial, but the federal government does have some power in this. I'm down in Nova Scotia, and I think about, the rights of elders in hospitals and so on down here. What can be done at the federal level to influence improvements at the provincial level when it comes to this legislation?
Sure. And it's definitely, certainly in Canada, which health law is definitely provincial, and most of what we do, I would say, the majority of what our office does is provincial legislation. The way that the federal government can sort of participate, I've just finished on the committee was looking at national standards for long-term care homes. They can't make them mandatory because it is provincial, but they're trying to work with the provinces to get those implemented, provide a tool to the provinces, for looking at homes to see if they, meet certain standards. And they're saying, here we have some standards for this is great. This is what you should comply with. Canada Health Act. So Canada has a Canada Health Act that doesn't regulate provinces, but it's really what it says is if you want the money, this is what you have to do. And so that's, basically the way that they have to do it is through the purse strings, is to say, we will fund, for example, maybe provide funding for long-term care if you meet these standards or something. Currently, long-term care is not part of our Canada Health Act. So, it leaves the provinces to sort of do what they want, really. And so that's something that, could be amended and could work. But again, it's often, the carrot is some funding mechanism for the federal government.
Look, thank you, Dominic. And I just want to take us back to this whole long-term care, Jane. And, we have a very mixed program across Canada, private, public, the standards, are good for some, but not good for others. And so, you're really working in quite a fragmented system at the same time as trying to advocate for change at provincial level and then federal level. How do you prioritize that? Because as an activist, you and I have been on a number of different committees. So how do you prioritize what you do from the person to the government? How does that work in your world?
How does that work in my world? I try to do too much. I'd say that's probably it. I was very lucky about 5 years ago that they added a second institutional advocate in my office who does more of the day-to-day work. I mean, I certainly do lots of day-to-day work. Don't take that's certainly not off my plate. But they do more of that, and I'm doing more of the policy and working with different groups. I think that obviously in Ontario, one of the things is, we are sort of one of the leaders in, for better or for worse, around legislation and policy. How it works in practice is a little bit different. But certainly is, something, if we can get something done in Ontario, often other provinces will follow. And so I think, prioritization for us is obviously in Ontario with respect to what's going on here. And then, so we look at the federal when things come up, whether it's something that we can fit into. So like the national standards were something that we fit in very nicely. And we're able to sort of look at our legislation and say, if you're going to have national standards, you're going to have to sort of look at the Ontario standards because we have them. And they're pretty good. And so, let's try to do that. And then, other provinces may follow in as well. So it's always a bit of a balancing act. And certainly we try to do as much as we can. But I would certainly say that because of what we do is more provincial, that's more of what I'm dealing with, because it is difficult, sort of like herding cats, trying to get all the provinces and territories to agree on things sometimes.
Look, herding cats would be simple, I think, compared to what it takes to bring provinces together. I'm going to go to Frances Wilkinson. Welcome, Frances. What's your question for Jane?
Well, it's sort of a follow-up to what you were just talking about, but given that, and I'm sorry to everybody who's here who's not from Canada, but I'm just curious, given that we will have a provincial election in the next couple of years in Ontario, and as parties develop policy, they tend to be all over the map. And I was curious from your perspective, if there was, what one issue do you think would be the most valuable for people to think about in that context of, developing policy concerning older people's rights in Ontario?
Yeah, I mean, I think in Ontario, our biggest problem is around home care and long-term care. And really, doing the planning, I think that successive governments. We've had one government for quite a while now, and the previous government for a long time. You know, neither party did great jobs. They talk a lot, but the action doesn't always come through. And I think that we really need to get a plan. And that's also a federal thing too, is one of the things we lack also is a federal plan on sort of how to deal with some of these issues. And so if we could have a roadmap that we'd actually follow. So, you know, we're in a real crisis in Ontario right now because we have, you know, 40,000 people on a waiting list for long-term care. Our home care system is terrible. And we have closures of homes that are going to continue to happen. You know, even the government saying we're adding homes. They had since 2010 had, you know, 15 years to replace homes. Homes in Ontario, long-term care homes are owned by a variety of different people. They're not owned by the government, but they're funded. But, you know, plans to rebuild very old homes that were very substandard were supposed to be done over this 15-year period. And really nothing happened. And, you know, I frankly kept, you know, saying to the government, to the ministries, to the local organizations that were funding these things, like, what are you doing? Where is this planning? These homes have to rebuild. You can't wait till 2024 and start to rebuild. It's going to take a long time. And of course they didn't do it because governments just have such short memories and short, you know, they just look so short in the future that they don't get anything done. And so we're in a real crisis. And I think those two things, getting some good home care to keep people out and making sure we have quality care when they go in, is very high priority.
Thanks.
And of course, Francis and everyone on the call, we know globally that during COVID, you know, residents in long-term care, you know, experience the highest rates of mortality in every single country of the world. And so there is no system that's perfect, but certainly the policy in Ontario and across Canada and in many countries, you know, doesn't certainly speak to this whole notion of the decade of healthy aging, which is to create an environment that enables older people to do what they have reason to value. And so I think it's an important flag for us. Jane, I just want to go on and ask you to talk a little bit about guardianship and conservatorship. You know, what is it? What does it mean? Why is it so important?
Right. So, you know, in Ontario, we don't have a huge number of guardians actually in Ontario, like court-appointed guardians, because we do have this legislation in Ontario which pretty much covers off a lot of certainly in the personal care realm, how to make decisions for people. And so I think one of the things, I sort of look at it from the other way, right, is to ensure that people aren't jumping in when a person's capable. And so especially around personal care, the system we have in Ontario, it's not an all or nothing system. And so you can retain capacity in many realms for quite some time before, you know, we don't really have a global incapacity unless you go to court. That might happen. It doesn't always even happen in court. You might get a partial guardianship. Around property, I think if you haven't done your proper property planning, what people find is that you know, when a person does become incapable, all of a sudden they can't, you know, access bank accounts, they can't do their taxes. You know, there's a lot of problems, and that's where you know, they're going to have to go off to court, or we actually have a system here where you can get a statutory guardianship where there can be assessments. Our public guardian trustee will take over managing, which isn't necessarily what you want to do unless you have to, and then family can take over for them, which is a lot faster and cheaper than a court application. And so if people haven't done their planning, you know, sometimes it requires like a guardianship or conservatorship or whatever's in your area. And I think that, you know, it is important because, you know, people do need decisions to be made around them. And, you know, we have to make sure that, people are protected, that proper people are making decisions. And I think what sometimes happens as well is, and I know even in Ontario, where we do have this sort of robust legislation, when there aren't those things in place, people don't go to court and they start to do funny things, and manage property in very strange ways. So I think that we need to make sure that people are being protected. And so I think, planning is important, but, those roles for example, a court or tribunals to make those appointments is very important as well. Oh, Jane, you're muted.
Unhelpful. Thank you. We've talked a little bit about decision-making disabilities. What is the process, to have an assessment on someone around their competencies to make decisions?
Sure. So in Ontario, it's certainly very complicated. If it's a medical treatment, it's up to the regulated health practitioner who's offering the treatment to determine capacity. And unfortunately, we haven't trained our medical system very well. And so the sort of a lack of understanding of how that works is quite problematic here. With respect to property, again in Ontario, and again it's so different everywhere, is so different even in Canada, and certainly around the world. I know it's very different everywhere, but in Ontario, it depends. If you have a power of attorney, it can just continue into capacity, nothing is needed. And if the person becomes incapable, somebody can continue to act. If not, you can get a capacity assessor who has certain authorities to determine capacity. And those are sort of the general ones that we have. So there's some legislated ones that we have in Ontario. I think that the problem is that we have lots of areas where it's not that clear. And if you don't have, for example, a power of attorney in Ontario, there are areas where there's nobody who has authority to make those determinations. And so it can really be quite problematic in Ontario, because we have these blanks. Sorry, I'm just going to close my curtain. I'm just getting blinded here. There we go. Sun's up. Sun's up in Ontario.
Well, look, that's good. And the law is complicated and different depending on where your jurisdictions are. I mean, we were very surprised that a death certificate in Ontario may not be recognised in Australia. So there are all kinds of areas that you need to unpack. Yeah. I'm going to ask Dr. Rao, do you have a question for Jane, or is it a comment? Dr. Rao? Asha Vijay Rao?
Good evening.
Good
yes,
evening.
I was just,
and what's your question? What's your question to Jane?
Question is not very this thing, but I say there is a making of will. Won't you suggest that people should make legal wills when they are able to think properly, they are capable to make decisions? Why keep it pending for so long that they are unable to take decision for their goodwill, their well-being, or their health and happiness?
Okay. So the importance of a will, Jane.
Absolutely, very, very important. And I think that, wills and powers of attorney both, I think that you're absolutely 100% right that people, don't do those things until they become older, and start sort of thinking about their mortality, I guess. And it's not an older person's issue. Really everyone sort of, once you hit the age of 18 for property, and in Ontario, you can make a power of attorney for personal care when you're 16. Not that I think many 16-year-olds have them, but I think they're very important. And I think it's an education and a piece. I think that people don't understand until, like Jane, you were saying, you've been doing something yourself and now all of a sudden discover how complicated it is. And I think that people don't understand that. And I also think that people don't keep up with them. So if you do, for example, make them when you're younger, have you had a life change, separated from a partner, so your will may no longer be valid. Like you need to revisit those things. And I would say that probably the biggest thing is that people don't want to pay for it. They're so upset, and yet they're really not that complicated. In general, like if you have a very complex estate, you're probably wealthy and have lawyers. But I think for the average person, they don't want to go pay a lawyer $500, $1,000 to do these things, and yet they don't understand the implications of what would happen if they don't have a power of attorney, don't have a will, and what the cost is going to be at the end. And I think, we need to do more education of people to not only say you need to do this, but why and what the result can be if you don't do it.
And perhaps it's organisations such as IFA and CARP and national seniors in Australia and Day and Age that really need to position themselves and work with, elder law specialists in creating opportunities to learn, for the individual, but also, the communities, the importance of this. Jane, we're coming to a close, but I encourage any other questions to come. I want to go back to this relationship between rights and abuse and scams and all of that kind of area, because we see increasingly, and I call them scams, that's all I can think of the word. They're becoming very, very sophisticated.
Mhm.
How, as an elder law advocate, do you participate in this conversation, whether it's with banks or others, to really unpack some practical advice for all of us, as well as older people?
Sure. And it's a real delicate balance too, right? Around the some of the scams and what have you. And I think that, we certainly have, been involved with banking associations, talking to banking people about some of this legislation and what do we look for? What do people need to look for? What do what I mean, personally, like one of the things I think they should ban is Bitcoin machines. We see people who are sucked into, having to pay people through Bitcoin machines. I don't really understand why you would have them. So I think we should get rid of those sort of things, and, making people aware of all these scams and what can happen. But the problem is, you're right, it's you fix one, like, so we've just fixed sort of the no seas in Ontario, but we know that they'll just go to a slightly different thing. And unfortunately, in those processes, we often think of these scams as being overseas, the grandparent scam, and they're very sophisticated now with AI and all of that. But we also have problems with, professionals. We unfortunately in the issues that we've been dealing with, there's lawyers involved and, mortgage brokers and things like that. And so I think that everyone really needs to be vigilant as to what's happening. And they're really, unfortunately, prey upon people who are vulnerable, often people who don't have family and supports there to say, stop. But you have to balance those with rights, because, I discovered that, one of the things that we have new legislation in Canada around some of these federal things where, banks are supposed to notify or to talk to people if they've, older persons, if they've I think it's a $15,000 if they're taking out sort of in cash or what have you, and they question them. And it's age 60. I'm over age 60. And so I was like, what? If I went into the bank and I wanted to take out money, some young person is going to ask me. I think the age is too low, but it's not for some people. And it's how do you balance the rights of the person to do what they want and not be overly intrusive, and yet to really protect them. And I think it's a lot of education. We use the media a lot, so we will try to get this. So we're very lucky to have a good relationship with a lot of media. So when we were having these scams and things were going on, we were calling the media and saying, we need a story on this, because that's where people are going to see, learn about them and know that not only are they there, but they're not alone, that there is help out there. Because a lot of people are so afraid to come up and they're embarrassed, right? And so then they sort of dig themselves into bigger holes. So it's a quite a difficult balance between, education, getting the sector involved, protecting the rights, but also protecting autonomy. And sometimes that gets forgotten as well.
It's certainly a delicate balance. Now, Jane, you've been in this business since 1993
Mhm.
or there around. So that's a good 20 odd years, is it? Or more?
30.
But 30, all right. My maths is not good at 7 o'clock in the morning, clearly. 30. So I'm a half glass full kind of person. So
Mhm.
I want to say there has been significant improvement. But where are we going to from here? Because I think we've got a rapidly aging population, increasing chronic comorbid conditions. We're told of the increased prevalence of people with, cognitive changes. And we have systems that are either a little bit wobbly or you say wonky, and fragmented. So where do you see the work of the Advocacy Centre for the Elderly in the next 5 to 10 years?
Yeah, I mean, sadly things don't change that much. And I think COVID was a prime example. Is that when COVID hit, we had SARS in Canada. We didn't learn from that apparently. Again, as I said, governments have very short memories, and I think we're really I think we really need to focus on the planning and to get the governments to plan for these things, because that's where really a lot of where it falls down is that they say a lot of things, but they don't plan, and they don't have long-term plans because they're only looking to sort of that next election or what have you. And I think that's where we really need to focus, is to do that planning, to make sure that people that there are the systems out there. So make sure that we have the home care, for example, and the prevention. I think that that's a big thing, is how do we prevent these problems from happening? So it's, making sure that people do have proper information about wills and estates, making sure we do have enough long-term care, home care. Let's keep people out of long-term care homes, learning from other places how well they do, and not have this mentality, which is unfortunate in government, is we often have this they often have this mentality of, well, we don't do what the last government does, we're going to do our own thing, and so they're constantly reinventing the wheel, and we have to focus on the people, not on the government.
Look, yes, we do have to focus on the people and not the government, but we do have a very short political cycle, and right seems to sort of be there, but never see the light of day in real terms. In terms of your particular work, you work as an institutional advocate. How do you tiptoe through private and public sector conversations? Because, private institutional settings, equally have residents with concerns. Are there any differences in the ways that you work?
I don't think so. I mean, I think that, even the sort of the private sector stuff that we have that we're working with, which would be long-term care homes, because some of our long-term care homes are private, although they are part of our public health system, they are privately owned. And so we have retirement homes, which are tenancies that provide services. They're not part of our health system, but they are do have oversight. But I think that certainly I think there's different ways of doing things, depending on whether it's a publicly funded or publicly overseen. There's different people that you can talk to, versus the private, where we're really getting a lot more, equity business, and who don't really care, frankly, in my opinion, about their businesses at all. They just care about the money. And that's become quite problematic. Certainly in our health system here, which is very unfortunate. And we were rallying against those sort of things, but they seem to be here to stay. So I think that I think there are certainly different ways of doing things. Sometimes it's a little easier when it's public because they answer to the community more. And so if you have a municipally run long-term care home, for example, if the home's not doing well, your community is very unhappy. They're also unhappy with the private facilities that aren't doing well, but people sort of shrug their shoulders and go, well, it's private, what can we do, you know? And I think it's sort of going to those institutions and trying to convince them and trying to talk to them, you know, how they could better serve the community while still preserving sort of their profits or what have you, and making sure that they're doing those things and that they're following the law.
Look, thank you for that. I'm going to now just turn to introduce next week's Global Cafe. And Jane, I'm going to come back to you and ask you to sort of share with us your takeaway message for the Global Cafe today. So stay with us and I'll come back and I'll ask Luana to, thank you, Luana, for putting this tile up. So next week, join us at the IFA Global Cafe, you know, to listen to Dr. Sophie Yaka and Dr. Luciana Lung, and they're going to be talking with us in conversation on the role of faith-based organisations in developing age-friendly environments. And of course, we know that during COVID, faith-based leaders and organisations were instrumental in many countries, you know, improving uptake rates, but also, you know, educating and promoting healthy ways. So Jane, before I come to you, I want to acknowledge that you have relatives in Australia that have joined us today. So thank you to relatives in Australia that have joined this IFA Global Cafe with Jane Meadus today. Jane, it's always great to come back home to talk with people that have been formidable in their fields across sectors and across disciplines. So thank you for the opportunity of being able to talk with you today. But what's your takeaway message for us today?
I think the takeaway message, and I think the thing that we probably need to do more of is education, is to bring these kind of ideas to your communities. And it could be educating your politicians, it could be educating you know, in your local churches, you know, we do speaking engagements in places like that, is to bring the messages to people that they do have rights, that they do, you know, they are important. And, you know, when we see any of these things that are going wrong, to educate, bring them to the media's attention if you see something wrong. That's a very good way of educating people. But education, I think, is the key to almost all of this, is that people, if they don't know what the problem is, they can't fix it.
And look, thank you, Jane. And just in closing, we thank also Dr. Whiting from Australia, who's just said to us, and I know she's one of your relatives, that there are many parallels, you know, in Australia that we've been talking about in this session today. So we thank you. You've been in conversation with Jane Meadus on the establishment and impact of elder law. And Jane is from the, here it is, staff lawyer and institutional advocate at the Advocacy Centre for the Elderly. So thank you. And of course, our conference is in South Africa, Cape Town, 9th to the 12th of September, 2025. So join us there. Thanks, Jane. Be well, be safe, and come back next week. All the best. Bye-bye.
Bye-bye.